Still to come in this evening South today. Sarah Farmer's on the beach with the weekend weather, but will the sunshine last?
Well, after a wonderfully sunny week, we have still got some sunshine in store for this weekend. I'll have your full forecast later in the programme.
A Dorset dental surgery is giving counselling to patients who are so scared they cry, have palpitations and suffer panic attacks. Some have to be sedated before they can even see the dentist. Dental phobia is more common than many people would think. Recent studies suggest that 36% of patients are routinely worried about going to the dentist, but about 12% are so deeply anxious they can be classed as phobic. The biggest fears, not surprisingly, involve needles and pain. One dental surgery in Highcliffe is trying to combat that with therapy sessions. Our health correspondent David Fenton has the story.
Okay, Julie, we're just going to go into the surgery and we're going to meet...
Julie Robinson has been scared of dentists since she was 8 years old. She panics, her heart races, and sometimes she cries. And that's just in the waiting room.
Okay.
It's the drill, it's the smell of the surgery, primarily the sound of the drill. This must be the childhood thing, because I can sit waiting in reception for somebody else and I hear that drill and I'm like, oh.
Okay, Julie, this is just a mirror, so I'll just open this up for you.
Today she needs an examination. She's had some counselling. Now a nurse talks her through what to expect.
And then a little bit of air, and I'll just blow it on your hand. Okay.
Some patients here are so terrified they need tranquilizers just to get them into the chair.
Worst case scenario, somebody will need to have some sedation, but we try to avoid that because that's actually not getting to the root cause, if you like. So once we know what the problem is, like with Julie, her childhood experiences, we can work through that with the patient.
Somehow, when you know exactly what the dentist is doing, it doesn't seem so frightening.
Many of those fears come from childhood memories of dental treatment in the 50s and 60s. Julie's fears stemmed from visits to a school dentist in Richmond.
The whole thing was just an awful experience. They didn't have the technology they have now, so it was always quite painful, and for a little child it was quite traumatic.
I put on these special goggles.
Caroline is about to start the examination. Some patients here just can't conquer their fear. One woman waited 38 years to see a dentist.
It's about getting to know them as a person and understanding why they're so worried and helping them through in small stages.
So well done, Julie. You've done fantastically today.
It's taken an hour to do a 5-minute examination, but for one patient at least, it was worth it. David Fenton, BBC South Today.
Okay.
Good.
Well, earlier I spoke to Heather Buchanan. She's a psychologist from Nottingham University, and I asked her why people suffer from dental phobia.
Well, people can become dentally phobic for a variety of different reasons, but probably one of the most common reasons is because they've had a very bad experience when they've gone to the dentist, and perhaps a very painful experience, and they've learned to become anxious about the dentist from that bad experience.
A lot of people will wonder, how can you conquer a phobia? Is it a case of just throwing yourself into the chair and doing it, or do you need to have a bit of a build-up?
Well, generally throwing yourself into it doesn't work nearly as well as actually gradually building yourself up to it. So if it's a dental phobia, it's a good idea to get yourself a dentist who knows a lot about phobias and is happy to take things slowly with you. And also psychologists can be very helpful as well. And so you might start with something like being able to sit in the dentist's waiting room and then get to a point where you're relaxed enough to do that, to then maybe build up to sitting in the dentist's chair and then being relaxed enough with that to go on to the next step, so that eventually you can have dental treatment without becoming very anxious.
And do you think as a society, and dentists in particular and things, are we becoming more aware of people's anxieties? Are we more understanding, or could we still go further to help people who genuinely are scared of things like this?
Yeah, I think that's a good question. I think we are becoming better at understanding people with phobia, but I think also we could still do a lot more to be understanding about it, because it is something that's very serious to people. When you are phobic, it is something which can dominate your life.
Dr. Heather Buchanan speaking to me earlier on today. Now, it's a question most of us will mercifully